The first step for us in the scientific method is going to be developing research questions. Now, research questions are actually really very much an art, and they really require us to study the literature quite extensively in order to understand what's already been done, what has already been stated, what actually represents a really good hypothesis that we can develop a research question for. But what we're going to do inside of this video is we're going to talk a little bit about a basic structure for research questions that will inform how we understand reading the literature as well as developing our own questions. So this thing is called the PICOTS Framework. And PICOTS is actually an anagram, and it stands for one, P stands for patient, that is the population, the group of people that we are actually looking to serve. Two, I, the intervention. What is it that we're going to be doing? When we talk about an intervention, that's that thing, right, the change that we make inside of the two groups that we think is going to actually improve outcomes, or it is the thing that we believe is causing the disease. C comparison, that is that we have two groups that we are going to be comparing, and sometimes what it'll be a group in one case, a group in another case, or one with one treatment, one with another treatment, and that's called our comparison. Then we have an outcome, the thing that we're looking to change. Then we have the time, how long do we think it's going to take in order for it to change, or how long are we going to give it in order to change? And then we have the setting, where it is that we're going to be taking place. Let's take a look at each individually in greater detail. First is the patient. So who is the patient population? One, we want to make sure that we're specific. We want to ask ourselves, is age a consideration for results? This is especially important in things like occupational studies, where one group of individuals may take longer to heal than others depending upon age. Does gender matter for results? So in some cases, whether or not we're looking at men or women or other genders might actually make a difference in terms of whether or not our treatment is effective. And then we want to include in the patient population any considerations that might skew results. So sometimes race has to be a consideration too, or like, for example, where the individual grew up or other things along those lines, because that may actually skew our results, okay? So some examples of this would be 8 to 10-year-olds with ADHD. We notice one, they're individuals with ADHD. Two, there's an age component of 8 to 10 years old. How about women with 18 to 25 with PTSD? So now we consider gender along with age and the condition. Veterans with right hemispheric brain lesion. Very specific, something that happens only on the right hemisphere. That would be on your side here, over here. And only looking at veterans. So we're looking at a particular population. Or construction workers with carpal tunnel syndrome. Why construction workers? Well, maybe construction workers' carpal tunnel syndrome happens to be fundamentally different from those who are in administrative careers. The next part is I. I is for our intervention. What is the treatment that you're testing? So one, you want to be descriptive. Like, let us know what it is that you're actually going in and treating or testing. You want to make sure that after reading your question, people should be able to see how your intervention is different or how it's being applied differently. So that's why we want to be specific. Oftentimes what we're going to see, especially in the literature, is the same kind of intervention being done with a lot of different populations, okay, or in slightly different ways in order to make the treatment more effective. And so consequently, we want to make sure that we are expressive in terms of what are the sorts of things that we're going to be doing that are in fact different from what everybody else has done. So some examples. Sensory processing materials. These are interventions. Yoga therapy, another, that's an intervention. Art therapy, hand splints, teletherapy. These are what it is that we're actually going to go out and do. Then we have comparison. Who are we comparing our population to? The individuals that we're trying to treat or we're trying to help, and who are we going to compare them to? Do we have a control group? That a group that we are going to remain, that is going to remain the same, that we're going to do nothing to? And we'll talk a lot more about that in experimental design. And what are the main alternatives that we're considering if we have a control group and we have a lot of different alternatives? So some examples, 8 to 10-year-olds without ADHD. So we have those with ADHD. We might have a control group or a group that doesn't have ADHD and see how they respond to our therapy. 18 to 25-year-olds who have recovered from PTSD. Non-veterans with right hemispheric brain injury. So if we want to see actually the difference between veterans and non-veterans. What we might also see too is the difference between those people who are using our treatment and those people who are not using our treatment. Because remember, we have that change requirement, that is that we are going to make one change, right? Before we actually, for example, exposed to disease Or we're going to make one change to the group to see whether or not we actually get some kind of effect. Next, O is for outcome. What do we hope to accomplish? What is the impact of answering your research question, right? What's the change that it's actually going to make? What variables are we looking to change? And we're going to talk a lot more about variables as well. Some examples: improving educational outcomes, attention, focus. Improvement on functional activities. Range of motion, establishing and increasing the range of hand. Improved feeding and reduction in pickiness of eating, improving nutrition and overall health. The fifth, is time. So time is this element that tells us, you know what, how long am I actually going to be giving the treatment, or how long do I think that it's going to take in order to actually get an effect? So how long after the injury will we be conducting the intervention? So like, for example, stroke, if we did immediately after stroke, we might get no effect at all. But if we take 2 weeks after stroke, we might get a lot of an effect. How long is going to be the intervention for? Some interventions, right, it's like we're going to give it once and we're going to see the effect. For many of you, like in the occupational studies, that doesn't make any sense at all. Do it once? No, you're probably going to have to take 6, 8, 12 weeks to give an intervention over and over and over again in order to see an effect. What is the time frame for which we can expect improvement? That is that, do we say, okay, I'll give the treatment, and then what I'm going to do is I'm going to wait to see if it has an effect? That's different from how often am I going to give the treatment. When will we be determining the efficacy of the intervention? So when is it that I'm going to do an after shot of my treatment? And what is the right amount of time to both determine the efficacy of the treatment and also prevent large costs? Because it's one thing to go out and conduct a treatment over a week. It's another thing to do it over 12 weeks. It's a very different cost level, and we have to put those into consideration as well. Some examples: 3 months after stroke, right? 2 weeks after injury, 6-week intervention, 1 year intervention. These are all examples of time interventions. Finally, we have the setting. Where does the intervention take place? Sometimes settings make a difference. We're going to talk about this quite a lot. For those of you who are in educational settings, you're going to have choices between like whether or not you're going to be doing pullouts. Are you in the classroom? Is it going to be one-on-one? Is it going to be inside of small group settings? Those are choices that have to get made. Does the setting of the intervention matter to whether or not we see results? And oftentimes you're going to see like drug interventions, they want it to work no matter what the setting is. But that doesn't make a lot of sense when you're doing something like occupational studies or occupational therapy, where the setting really does matter, where you might see great effects if you're inside of a skilled nursing facility, but if you take the individual out of the skilled nursing facility, we see no effect at all. And then setting can also refer to the activity that is being conducted. That is that what it is that we're going to be doing can also be part of the question that we're looking to answer. So some examples of that would be inside the classroom versus outside the classroom versus an individual pull-out. We talked about that. A skilled nursing facility, in the home, while exercising, for example. Now, let's take a look at some examples and see if we can actually identify the PICOTS. Let's look at the first one here. Will the use of yoga decrease the incidence of depression in Alzheimer's patients? We're going to use a 12-week yoga intervention to see if persons with late-stage Alzheimer's have fewer depression symptoms post-treatment. We will be comparing the patient's depression symptoms before and after the treatment. So let's first ask ourselves, P, population. What's the population? It's Alzheimer's patients. 2, what's the intervention? The intervention that we're going to be using is a yoga intervention. Okay. C, what's the comparison? Well, the comparison in this case is going to be a before and after. We're going to compare the Alzheimer's patients before, and we're going to compare the Alzheimer's patients after. What's the outcome? The outcome that we're looking to make an effect on is depression. Whether or not we actually see an improvement in depression symptoms. T, what's the time frame? That's the 12-week yoga intervention. And then S, what's the symptom, the setting? The setting for us, we actually don't see what the setting is. Maybe the setting is that yoga, the yoga treatment. Or excuse me, the yoga class. Let's take a look at the second one. Will the use of bed rails decrease the number of falls for residents of a skilled nursing facility in a 3-month period? We're looking to decrease injury and decrease mortality due to injury through the use of bed rails. We will be comparing these individuals to patients in skilled nursing facilities without bed rails. 1, what's our population? Our population is those individuals inside of the skilled nursing facility. I, what's the intervention? The intervention is bed rails. C, what's the comparison? The comparison is going to be between individuals inside of skilled nursing facilities with bed rails and those without the bed rails. O, what's the outcome? The outcome that we're looking to do is we're looking to reduce falls. We're looking to change the number of falls. T, what's the time setting? We actually didn't set up, we set up this time setting and it's a 3-month period. That is, we're going to see whether or not we get fewer falls over 3 months with the bed rails than without them. And then finally, what's the setting? Well, the setting is that skilled nursing facility, which obviously is part of, right, our population. And in some ways, it's also part of the intervention that we're setting up. Let's look at the final question. Is the use of in-class occupational therapy superior to pull-out occupational therapy for improving attention in early age elementary school children? Well, first, what's our population? It's early age elementary school children, 6 to 8. Second, what's the intervention? That is, our intervention in this case is in-class occupational therapy, okay, versus the pull-out therapy. So it also happens to be our comparison. Our comparison is going to be the in-class versus the pull-out. So we're going to have that 2 comparison groups, and that's also going to play into the idea of our intervention. O, what's the outcome that we're looking to do? We're looking to improve attention. However we choose to actually define or measure attention, that's up to us, but we're looking to improve attention. What's the time setting? Well, this one actually doesn't state a time setting. So maybe it is that what we're going to have to do is we're going to have to set up a time setting as part of our experiment. And then finally, what is the setting? Well, the setting is going to be probably inside of a school, 1, inside of the class, 2, inside of a pullout. So in both cases, we're talking about children in school. So consequently, we don't have, like, for example, homeschool students. That probably is not part of our experiment in this case. We're looking to develop an idea whether or not we should keep the students in class if they are at a school, or whether or not we should use small group pullouts. So what we've done now is we actually talked about the PICOTS, the PICOTS. Then this anagram stands for a good way to think about how we develop questions. So when you're developing your question, you're going to be thinking about it from this perspective, or you can think about it from this perspective. 1, what's the population? 2, what's the intervention? I. 3, C, what's the comparison? 4, O, what's the outcome? 5, T, what's the treatment? 6, S, what's the setting? You may or may not have a setting, and you actually see, if you look online, we'll see some that have PICOT and some that have PICOTS, like I have here. That finishes the lecture.